Let's reduce medical error. That'll improve outcome and lower cost. Let's give the right drug to the right patient at the right time for the right indication at the right dose. The 5 rights, that'll reduce cost and improve outcome. Let's improve communication and not street a patient like Tom Duncan. Let's get our information technology backbone to really work. Let's give doctors and nurses and pharmacists good information about what the heck it is they're doing every day, teach them how to improve, and then get the heck out of their way so they can do a better job. Whoa, that's an exhausting agenda right there. So here's the IOM list of how to do it. Now, we're not going to go through all this morning, but note that prevent medical error is the #1 way to improve outcomes and lower cost. So in your conference about quality, that is the key take-home message. So we got a couple of messages already. Transparency, accountability, number 17 in the world, 20% of what we do has good science, and we can improve outcomes and lower costs. Here's the battle plan with all your medical leaders across the system are working on in your health plan and in your hospitals. Super important. We'll come back to that when we talk about reform. Okay, well, here's the best definition of quality that I know. This has been around since 1991, first promulgated by the IOM, so a pretty reputable source, but 1991, we've been at this a long time. So you could read along with me, the degree to which health services for individuals and population makes me feel good as the dean of the only school of population health. That's part 1. Part 2, desired health outcome. That means amazing. We got to ask patients what's important to them. Hallelujah. Do we do that today? Better question. Do we get paid to ask patients what their desired health outcome is? In our heart, every doctor in this room knows we do not get paid to do this. And the third thing, consistent with current professional knowledge, that's our code word for practice based on the best available evidence when you can find it and where it exists. So summary, population focus, engage with the patient, more about that later, and evidence-based medicine. That's a tall order. So this is the best step for board members. This is it. This is the best definition I think I could find for you folks for sure. Okay, so everybody in this room by now, and I know we have one of the authors in the room, which is wonderful. So To Err is Human, you remember this book, right? 1999. Hard to imagine. President Bill Clinton was in the White House, you get that, right? And he held this up in the press room, and he said, I commit my administration to reducing the epidemic, his words, the epidemic of medical error. 15 years later, medical error, the 4th leading cause of death in our country. You don't believe me? Go read Peter Pronovost, Bob Wachter, Jim Bajan, and a host of the high priests of quality currently at work in our great country. What did this book do? Well, it enabled us to have this conversation. How do you like this cover story? That'll get your attention. This is Marty Macary's book from Johns Hopkins Medical School, my good friend, called Unaccountable Care. Now, that's a bestseller. Or as my wife would say, that's a page turner. How to stop hospitals from killing us. Yikes. By the way, board members, let me remind you, buck stops with you. It's all about you. The chair of your board quality committee and your board chair working together, they are ultimately responsible for this. Not the CEO, not the CMO, you guys. That's pretty scary. That's why you're here. So To Err is Human, 1999. The good news is, the last 20 years, we've been working hard at this. We've been trying to figure out how do we fix this mess. And one of the most important things we've learned, of course, the top 10 ways to improve quality and safety, the #1 thing is we all were taught by the time we were 5 years old, which is, of course, wash your hands. How ridiculous is this?